Hello, hi everyone. Welcome to Fervid Orb, yet another show. I'm Naazin Haseeb here, life coach. Today we have with a very renowned dermatologist with us, Dr. Sonia Feroz. She had been in industry for a pretty long time, and recently she was listed in the top 10 dermatologists in India. She also ran her institute, Zarin Laser Clinic, in Trivandrum for 6 years now. Let's warmly welcome her to the show. Welcome to the show, Sonia Feroz.
Hello, Nazin.
Hello, hi.
Thank you so much for having me here. Thank you so much.
It's my pleasure. It's my pleasure here. And yes, I thought of bringing this topic in forefront on psychodermatology because there's always this, when people look at a person, there's always a perception that first goes inside how the appearance is appealing. We invite certain people on their looks, how their face is, and how are their costume and how are their shoes also. So, when people have this psoriasis or any kind of itching sensation, all that, all those all dermatological issues, they have this fear to come forefront to society and talk. That a lot of interpersonal and conflict happen within themselves. So how can you narrate to these clients? This is not an external issue. It's more of an internal issue, and this can be cured with a lot of affirmation and with of less medicine. So can you just explain on?
Yeah, true. As you rightly said, Nazin, dermatology or skin. Skin is the largest organ of our body and it covers our full surface. So this is the external package or the external cover, which actually covers our whole self. So skin is a mirror of whatever is happening inside, whether it's a physiologic thing or a psychologic thing. So both of these two has got an impact on the skin, and the skin has in turn an impact on our psychology also, because the way we look is partly or more than 50% is by the skin color, by the skin texture, or how good is your skin, how bad is your skin. I mean, the color of the skin, so many things. So there is a branch called psychodermatology, and the psychodermatology deals with the connection between the psyche and the skin. So it's more than what we think it is. It's more than what we think. The first part is the skin as such. Our appearance has got an impact in our personality, in our behavior, in our personality, and how we expect the society to welcome us. So that itself, this has come to a lot of dysmorphophobias. So skin and skin changes is one of the causes for a dysmorphophobia, because however beautiful they are, however good they are, sometimes they come up with a thought that they are not good enough or their skin is not okay. They have rashes on their skin. In the cosmetology world, I deal with a lot of cosmetology issues, even the acne. A normal pimpled adolescent will come up and say, "Doctor, I am the most ugly person in the world." So that is how they perceive themselves. So from there, the journey of a dermatologist is always hand in hand with either a physician or a psychologist, because we definitely need a person to support this kind of issues. So broadly, this can be divided into the skin diseases which are exacerbated by stress or psychological issues. Like, for example, you have psoriasis. Psoriasis, almost 45 to 80% of individuals say that their disease flared up when they had a stress. Okay, when they had a stress, their disease flared up. And because of the psoriasis, again, they went back to a depression, or almost 5 to 5.5% individuals say that they had suicidal ideation because of the psoriasis aspect on the skin. But this, if it is rightly pointed out by the clinician, if they have an open talk with the patient, definitely these things can be sorted out. And there is a stigma still in the patients that we cannot send them to a psychiatrist or a psychologist for a counseling or medications, definitely. So the interface, the first interface is between the dermatologist and the patient. So we, for some part, we behave as partly a counselor or behavioral therapist. But then there are patients who need actual treatment from a psychologist or a psychiatrist.
It has become a very much of a biosocial, biopsychosocial phenomena these days, that, and people are not able to understand when we always say that you have to look inside and see what is your real cause of trouble. They said, no, this is something to be treated by a doctor or something to be taken by a medication. Only then we'll be cured. So how do you overcome this? How do you able to establish them that, this is not a factor, and please, what is the insight on that?
No, our consultations usually it takes almost 50 to 20 minutes. Talking not just about the disease, because treatment of psoriasis, just one look itself, the doctor can prescribe the medication and give the thing. It's okay for a dermatologist to diagnose a psoriasis is not a big issue. Diagnose a disease, it's not a big issue. But making them under, because these are all, if you take the list of psychosocial diseases, mostly are chronic diseases which comes and goes and comes and goes, and it is almost in a long span of their life it is still having it, so it has got a long impact. So sitting up with them and talking one by one regarding their apprehensions, and it's a long consultation which we usually have with them, and sorting one by one. And at one point, we understand that she or he requires a proper psychological intervention. So definitely in my clinic, I have connections with a group of people around who can give support to these kind of patients. So in a very nice manner, we put them across so that this can be sorted out with them. And definitely when they come back after a counseling or after making them understand these things, or even with a psychiatric treatment protocol, definitely the skin problem starts improving on its own. So, yeah.
So it's absolutely, so you don't go for the prior test or blood sample or any skin patch test, nothing like that, or how do you process it?
No, for diagnosing a skin disease, just like I said, there are, okay, I will divide how we diagnose this thing into 4 different categories. Okay, one is, as I said, some diseases which are exacerbated by stress. Like if you have psoriasis, if you have atopic dermatitis, eczema, if you have some hyperhidrosis, like just sweating, excessive sweating, they come and tell us like excessive sweating. Or there is something called urticaria, the rashes which are coming up on the skin. These are diseases per se, which require testing with the blood samples and testing with skin scrapings or sometimes biopsies. So these are particular skin diseases. But the exacerbation, what is making it come at this point? Why they are coming up with this right now? Why there is a flare up? Why the person is having this now? This question is where the psychiatric part also comes in. So the psychological part also comes in. That is one issue. Number 2, second category is certain psychiatric disorders, something inside cause a problem outside. That is, there are certain psychological or psychiatric patients trauma with some OCD or some depressive characters or something like that. They come with inflicted trauma. Maybe they are coming up with some area of ulceration, very odd looking ulceration on their body, or some coming with a patch of hair loss. So when we look at them, this pattern is very typical.
Yes.
Very typical pattern. It is not fitting into the usual diseases.
Yeah.
It does not fit into the diseases. So there are definite patterns. As a dermatologist, we are trained to identify these kind of issues which are implicated onto the skin. Like there is another one called delusion of parasitosis. Typically the patient will come and say, I'm having itching all over the body, and I saw an insect, I feel an insect crawling. And this patient typically comes with a matchbox. Inside there will be a keratinous plug or something which they took from the skin and say, this is the insect which I caught. Okay. So every patient of delusion of parasitosis will come with the same history. So whenever they say this history, we don't even have to check for most of the other things. It's so typical for that psychiatric thing which is there. So we dermatologists are trained to see these things as majorly psychological problem, which is in turn causing a skin issue. So definitely we'll listen to them. We'll listen to their the problem. There is an ulcer, if there is a trauma, we treat it. We give them some antihistamines to improve their itching if it is itching, or we give them medication for the hair to come back. But we know that they have to be primarily treated by a psychiatrist or a psychologist. So it is their arena. So you understood these two things, like there are diseases which is increased by stress, and there are internal diseases which cause system. So this has to be identified. So it's a very tricky thing. If you have a very busy practice where you cannot talk with the patients too much or cannot give more than 5 minutes time, most of the time doctors might miss this window. Okay, so it's very important to have a good narration or sit with them and have a discussion about it.
The talk time is essential.
Very, very important.
Yes, and
go ahead, Naazin.
No, I was just suggesting that when we look at it, it's always that harmony of mind and body have to be maintained, only with quality of improvement in life. Quality of improvement as in exercises you have to take. You have to if you're stressed, give a breathing exercise for yourself. And when you're close to an environment, try to dehydrate yourself. Try to hydrate yourself, and so that itchiness or scaling, that sensation will reduce. So these are and the diet also, even you take proper diet, you won't have that, that gut, you have always that gut itch, that causes psychic problems and which causes dermat problems, which this is a vicious cycle, go through.
There is a cycle called the neuroendocrine cutaneous system. Like the nerves, our endocrine hormones and the skin is connected. So that is why many of these things go hand in hand. So there is, for example, if you have an atopic dermatitis, which is an eczema, which comes in young children. So when there is this eczema in a young child, the trauma is mostly for the parents. Because the parents has to take care of this child. The child cannot do anything for herself. So if the patient or the child is getting recurrent exacerbations, like every time he's having flare-ups of eczema, the treatment is for the child. Okay, that's true. But the treatment is for the should be directed towards the parents also, because there is some family dysfunctional harmony or disharmony going on there, and that will itself, because having an eczematous child in the home itself is very stressful for the parents. So they cannot break. they cannot bring the child to the public. Some people will ask what is happening. Some at schools they say, oh, this is a crocodile skin and what is happening for this. And you know, these kind of things, even the parents have a lot of impact on. So they try to either ignore the child or just take him as a burden, or there are so many implications there. So it's all connected. So we have to, dermatology is very important because see, another aspect is in the cosmetology world. Like, for example, a person is coming up with a small patch on the face, with a dark patch or pigmented patch. And yeah, that person is considering that pigment as the most difficult problem of their family or of their life. And they say, my husband is divorcing me because of this patch and the So we will be surprised to see why they are talking like that. But if you go deeper and deep inside that point, it's not this patch. There are something else happening inside their family. So the person is attributing it to its
a citation. It's just a citation.
And then they think that once this is removed, their family problem is solved. So
again going under night for plastic surgery, body shaming, because of body
to improve their body. They think that this is what is the root cause. So if we don't identify that person at then and there, either you are creating an unhappy patient, or you are creating a permanent
psychic
patient and again, like a hospital bird. And so that doesn't
the
happen.
person will just go shopping doctors, not this doctor, that doctor, goes on fetching doctors and invest a lot of money.
They end up totally unhappy with their family and with their treatment also. They're never happy with the doctor.
Eventually, it's an end of life. We had come across many situations like that. Even teens, even a married woman, even mid-age also. Men also, they think that acceptance is not there. Society's
teenagers, especially young boys, when they have acne on the face, they really hate to have that acne on the face because they think it is a female thing and you are having all those stuff.
Hormone changes,
they pick on that, and a condition which is called acne excoriae. So when you see a patient with acne excoriae, that means excoriated acne with black patch, you can see that they have actually scratched the whole thing. So again, we are trained to identify acne excoriae as a psychological problem, not as an acne. So at this point, we have to intervene and question about what is going on in his mind and what is going on. So there are clues which the patient give us that this is a psychological thing is also there. But once we treat that, definitely the patient is going to come back happier, their skin improves, and it's a vicious cycle. When the skin improves, the mind also improves.
It's also a reverse way. When the mind is cleared, also you come up with beautiful skin, beautiful skin texture. All that changes. Even the hair falls which they had, they say, no, we have the hair growing back. It's a very healthy body. We don't have joint pains. All that, it's a reverse circle which comes in.
Exactly.
And psychodermatology.
Latest in the pandemic, now what we are facing is post-COVID hair fall or post-COVID problem, because COVID itself is a bodily stressful thing, like which went on. Either it's a psychologically stressful or it's bodily stressful. So once that stress period is done, 2 or 3 months later, they can see immense, tremendous hair fall. This tremendous hair fall is caused by the stress which happened at the time of infection. At the time of infection, it was an arrest of the hair growth. This happens after a family will have any loss in the family, like death in the family or some stressful situation in the family. After that, or maybe it's a exam time that they were too much stressed out. Exactly 2 months after that, after the stress is over, they see the hair fall. So they think, I'm not stressed now. Why is it happening now? That means the stress which happened 2 months back has arrested the hair and that hair is falling off at this
Yes,
point.
yes.
So there is a huge connection, Naazin.
Yes,
So
yes.
it's
It's a
it's
immune
an
system.
inseparable,
Yeah, it's a immune system, the HPA axis, all combined work. And yes, so
inseparable.
yes, it's our mechanism, the whole mechanism is not in our hands, but we can control all
Yeah.
that, controlling our mind and bringing a change in our diet and habitual process, bringing a healthy process, and making yourself happy every day will cure all your ailments, whatever ailments you come across. That being happy, making others happy is the best thing you can do in life. And that on that note, on that self-care week, I just conclude that keep a good health lifestyle, and and bring a lot of joy in life, and that will be enough for getting rid of all the ailments you come across on your gut or your skin or any part of the body. So thank you, Sonia ma'am, for spending time with us, and it was very good insight. And another thing is that even psychodermatology is very beautifully classified where each ailments belong, and it's very much clear. So reaching to dermatology, you can really understand where you stand and what cure it can be done. So yeah, please visit Sonia ma'am, whoever is listening to us today. And thank you so much. Thank you for being with us, and happy Friendship Day. And thank you. Enjoy your day.
Thank you so much.
Thank you.
Thank you so much, Naazin, for having me here. Yeah. Bye-bye. Bye.
Bye-bye.